Hi everyone, Sam here. I am presenting Metformin as my final webcam presentation for advanced pharmacology. I thought it was important to me to kind of talk about the history of metformin and where in its uses from the beginning of time with over a century of history. I think it was important for me to talk about it a little bit and interesting. It was originally driven from a plant called Galliga officinalis. Um, with different areas, they call it different things like French lilac, goat's rue, um, Italian fitch, and then milk pea. But it was used as an herbal medicine initially for patients that had extreme thirst, but they also discovered that it was lowering blood sugar. So imagine that. And, the extreme thirst, as we know now, is a sign of diabetes. So it's kind of all interesting how they were treating side effects of diabetes, but they couldn't put their fingers on it, the scientists, all those many years ago. In 1940s, it was rediscovered, but this time it was used for treatment of flu. But then they found it was lowering blood sugar. So imagine that. In 1957, this is when it was properly named metformin, and it was used for treatment of type 2 diabetes by a French physician named Jean Stern. Unfortunately, in 1970, they discontinued it because of the high risk of lactic acidosis or metabolic acidosis, and it was taken off the market for its use. In 1995, it was introduced in the United States for treatment of type 2 diabetes, but it wasn't the initial. It was just, yes, it's okay to use it now. In 1998, UK physicians and researchers found that, the profound long-term benefits of cardiovascular when it was taken for type 2 diabetes. And then now is the gold standard for initial oral treatment to be used for type 2 diabetes. Medication and class name and class. Well, metformin is the only medication in this class called biguanides, and it comes in immediate release and extended release. It, the immediate release comes in 500, 850, 1,000 milligram, and its initial recommended dose is 850 milligrams daily to 1,000 milligram daily. It also has a lot of brand names: Glucophage IR, Glucophage XR, Fortmet ER, Glumetza ER, and then Riomet is the only oral solution of metformin. I think it's important. Most of the literature was saying the extended release should be taken nightly, whereas the immediate release can be taken during a day or nighttime, but it's usually end up being twice a day. Target population, well, we know it's initial treatment, oral anti-diabetic for type 2 diabetes. FDA approved it for ages 10 to 80 with normal kidney function. That's the caveat. It is important to have proper kidney function because metformin gets excreted as a whole through the kidney. It doesn't get broken down in the body. So we need to have a good working kidney system to get it out of the body and not cause metabolic acidosis. Clinical indication for use, well, beside the type 2 diabetes, is also used for prevention of type 2 diabetes. So it's used in, pre-diabetics, as, has, I guess, been called. in obese patients, gestational diabetes, polycystic ovary syndrome, or PCOS, and myself personally was prescribed this medication for that use, pediatric obesity, and obesity related to antipsychotic medications. It's also worth mentioning that we continue to find the benefit of metformin, in patients that use the medication along with other fertility drugs. It increased the fertility and chance of getting pregnant, increases longevity, and they found cancer prevention benefits, especially in colon, prostate, and breast cancer. Of course, more studies needs to be done to really say that this is true, but these are just benefits that we see. A group of researchers looked at COVID-19, and especially in women that were using metformin for type 2 diabetes or obesity treatment were less likely to die from COVID-19 illness. And again, more information is really needed, but I just thought it was interesting, so I wanted to mention it. Mechanism of action, well, we know the metformin has 3 ways that it works. It inhibits glucose production in the liver, so it decreases gluconeogenesis. It reduces gut absorption in the glucose absorption, in the gut, which kind of explain why we have the GI symptoms, which I'll mention here in a little bit. It sensitizes insulin receptors in our muscle to uptake glucose better. So I think that's probably why it works so well in lowering blood sugar. Here's a little bit of a visual. For the visual one, I'm a visual learner, kind of showing the organs and the body parts that it works in. Most common side effect of metformin is really the GI one, and unfortunately in 3 to 5% of these in patients, these symptoms are so bad that it has to be discontinued. They just cannot tolerate it, which include decreased appetite, nausea, diarrhea. And then in some patients, it has shown to decrease absorption of folic acid and B12, which may lead to worsening of diabetes, neuropathy, or pernicious anemia, but it doesn't cause, it's important to mention that it does not cause diabetic neuropathy itself. It just makes it worse, the symptoms. Contraindications, well, we know it's contraindicated in renal impaired patients that are older than 80 years old, which, patients that are old in this population, and they have age-related kidney function issues. Patient with congestive heart failure and patients who are alcoholics, all of these increases the risk of metabolic acidosis. Laboratory and diagnostic tests needed for diabetes or monitoring this medication. Well, we need to be diagnosing diabetes first, and we got to check the hemoglobin A1C if it's greater or equal to 6.5, fasting plasma glucose greater than 126 2 consecutive time, oral glucose tolerance test greater than 200. And then after that, hemoglobin A1C every 3 months to monitor the effect of this medication, but also making sure, patients are not getting too hypoglycemic because of the trifecta mechanism of action. It can lower blood sugar too much, especially in older patients. CMP14, it's definitely needs to be done before initiation of this medication. It does include a lot of the panels that look at the liver, look at the kidney, and other electrolytes and functions in the body, and at least annually after that. CBC annually, fasting insulin, and vitamin B12. It's important to be checked initially and then thereafter. Patient education, well, I think it's important to remind our patients that treating diabetes is just not, medication is not fix all. We need to have a healthy, balanced diet, regular exercise, checking the blood sugar, and then staying in contact with your healthcare provider. But also taking, monitoring for hypoglycemia, take the medication with food to decrease GI side effects, take medication as instructed by provider, report any new symptoms to provider, and like I said, follow up with the provider. There are a lot of resources for diabetes. I'm not going to spend a lot of time with this, but all you really have to do is search metformin and or diabetes, type 2 diabetes. There's a lot of information in the internet, but also in a doctor's office and in pharmacies. All patients have to is ask. And here are my references, and I really thank you for watching my presentation.